Today I'm here with Karen Burns, Pelvic Floor Physiotherapist. I've been lucky enough to work with Karen for many years now, and she's going to share some insights not only about herself and why she chose physiotherapy, but her work as a pelvic floor physiotherapist. Karen, can you tell us a little bit about yourself?
Yep, so I'm a pelvic floor physiotherapist and I work at Woongarra, and I treat women, men and children as well as general physiotherapy patients. I really love being a physio, and I look forward to working for many more years as a physio. I graduated from Sydney University in 1991 with distinction, and I started working straight away at Concord Hospital, and I spent 10 years rotating through different areas there. I then moved to beautiful Lake Macquarie and started working in private practice. I developed an interest in pelvic floor physiotherapy, and I've been treating pelvic floor patients since 2009. I think we have a lot to offer patients, often in more ways than they know, but I also love being active myself, and I love helping people to become fit, strong, moving and active. And I love learning, so I enjoy learning things new all the time, and I am a scuba diver, and I love spending time with my two gorgeous children and our dog.
So Karen, what made you choose to become a physiotherapist?
So I always wanted to be a physiotherapist. So from year 9 in high school, I was wanting to be a physio, and I went to Sydney University straight after finishing the HSC, and then started working at Concord Hospital, where I rotated through numerous areas of physiotherapy, and then into private practice. I love helping people, and I really enjoy what I do. I find my work very rewarding.
So Karen, as a pelvic floor physiotherapist, what does a typical workday look like for you?
Well, I do love coffee, so my typical workday begins with a coffee and preparing for the day. I typically see a patient every half an hour or maybe an hour, depending on what's required. And I also have time for paperwork, so phone calls, letters to doctors, things like that. I spend time mentoring other physiotherapists in the practice, but I also really love promoting pelvic floor physiotherapy any chance that I get. So you might find me visiting a local gym to talk to them about pelvic floor safe exercises, or I might visit a local area health service to talk about pelvic floor physiotherapy.
Wow, some good information there. So what does a pelvic floor physiotherapist actually treat?
Yep, so people are often surprised at the range of conditions that I treat, because it's quite extensive. So I treat women, men and children for bladder, bowel and pelvic pain conditions. So there's a vast array of conditions that fall under that. So for example, there's urinary incontinence or fecal incontinence, but also I might treat someone for urgency or frequency. So they might not actually be incontinent, and that's why I prefer to be called a pelvic floor physiotherapist. So urgency, for example, is like a sudden intense need to go to the toilet, not being able to hold on, or frequency, having to go to the toilet really quite often, or for some people not going to the toilet often enough. There are other conditions that might be helped with this sort of physiotherapy, so things like pelvic pain, coccydynia, pelvic pain type of conditions. But I also see people for constipation, straining, which can compromise pelvic floor, prolapse, hysterectomy, menopause. I see women through pregnancy, after they've had their baby. I might see someone for recurrent UTIs or urinary tract infections. I even see people following colorectal surgery, so they might be going to have their stoma reversed. And then with pelvic and sexual pain, that's things such as vaginismus, dyspareunia, vulvodynia, interstitial cystitis, endometriosis, SIJ pain, and a vast array of pain conditions. And children, of course, can have problems with incontinence or constipation and straining, but also a common one I see children for is bedwetting and wetting during the day at school.
And for a woman coming to her first consultation with you, What would she expect to learn and to find out in her first session?
So very fortunate at Woongarra to have private rooms for our consultation, and usually our consultation goes for an hour, so it's quite a detailed examination. It's really important that I understand exactly what's going on for you, so I take a very detailed subjective examination, which means you get a chance to tell me your whole story, but also I ask you lots of questions about your functioning and your lifestyle. There's then usually an physical exam, which for women can involve an internal exam if you're comfortable, and I can also use the real-time ultrasound, which has a probe that can be placed on your lower abdomen, and we can see the pelvic floor contraction or your core muscle contractions from there. After we've done your examination, I usually use the pelvic model to explain to you exactly where your muscles are and what's going on for you, and how we can treat that, and what's involved and how long it's likely to take. Often people are given exercises to do, but it's really important that you're doing the correct exercises. So some people have strength, but that might be working on strength or endurance, which is how long you could hold your pelvic floor contraction, or the coordination and the function of the muscle. Or some people need pelvic floor relaxation, and that's why it's so important to have a detailed exam so we know exactly what's going on and how to treat it. Usually given some homework at the end of your session, so it might be something like bladder diary or food diaries, and we look at those when you come back for your follow-up session. We'll organise your follow-up session and I'll tell you what to expect from that, and then I usually send a full report to your doctor.
And you mentioned you also do male pelvic floor physiotherapy. What is different about a male physiotherapy consultation for pelvic floor, or is it the same as a female consultation?
So for men, we make our way down to the private room, so that you've got complete privacy and confidentiality. We take the detailed examination, so again you get to tell me your whole story, and I ask you lots of questions about your lifestyle and your function. I'll also ask you about your prostate cancer, if that's what you're seeing me for, or any tests or exams that you've had. And then we often use the real-time ultrasound for men, which can be placed low on the abdomen or on the perineum, so that we can see the pelvic floor muscles and what they're doing during the contraction. We then work together to plan your treatment, and we try and put together a program that's going to be realistic and achievable for you. And I explain to you exactly what's going on, why you're having the problem that you're having, and how we can fix that, and how likely that's likely to take. And again, I'll send a full report to your doctor afterwards, and we'll organise your follow-up session so you know what to expect. And often there's homework to do as well, such as your bladder diaries or your food diaries.
Wow, it sounds like you go very in depth and really get to know your patients, Karen. Something that patients ask me as a physiotherapist is, do I have to do pelvic floor exercises on the floor because they're worried about having to get up and down? Do you actually have to do pelvic floor exercises on the floor?
Yeah, so it's a good question, and no, you don't. So if you've been putting off coming to have pelvic floor assessment because you're worried you can't get onto the floor, don't worry. The exercises are chosen specifically for what needs to be done for you. So it's called pelvic floor because the muscles sit at the base of the pelvis. So if you think of the pelvis sitting at the bottom and the abdomen wrapping around, the muscles are at the bottom. So that's how it's called a pelvic floor. It's actually really important what position you do your pelvic floor exercises in. So I carefully choose whether you do them lying on the bed, or sitting or standing. Often as patients get stronger and progress in their therapy, they move on to much more advanced pelvic floor exercises, which are more challenging and engaging. But no, you don't have to get onto the floor to do your pelvic floor exercises.
How do you know if you're doing a pelvic floor contraction correctly?
So it's really important that you're doing your pelvic floor exercises correctly, because actually if you're doing them incorrectly, you could make your condition worse. We know that if you just give people a pamphlet and say that's how you do them, about 50% of people will be doing them incorrectly. Also, we need to work out what aspect of the pelvic floor function is letting you down. Is it the strength? Is it the endurance, or how long you can hold the contraction? Or is it the coordination? Or is it actually, in fact, that you need to relax your pelvic floor and that you don't need to do strength work at all? So the only way you can tell if you're doing it correctly is actually to have a full assessment with a pelvic floor physiotherapist, such as myself. We do the full examination, including a detailed history and a physical exam, and then we know exactly what's going on, and we can plan together your treatment and set realistic exercises that are going to be achievable for you.
Now, you told us at the start how much you love your coffee. One thing patients with incontinence and bladder issues worry about is having to give up their caffeine. Do they have to give up caffeine?
Yes, so as you say, I love a good coffee, and I actually like plenty of tea as well. So the answer is it's not necessarily. We do a full assessment to work out exactly what's going on and why you're having the problem that you're having. Caffeine may be a contributing factor, but it may not. So we often do bladder diaries, and we can see the effect of the caffeine on your function, and then it's up to you. You make the decision. You're always in control. I'll make the recommendations for what's best for you, but you get to decide whether you give up the caffeine or not.
Karen, you've talked about bladder retraining. I'm sure a lot of our listeners aren't 100% sure what that term means. Can you explain to us, what is bladder retraining?
Yeah, sure. So bladder retraining is another part of pelvic floor physiotherapy, but it's actually separate to the pelvic floor exercises. So if you haven't had a chance to do your pelvic floor exercises, I still encourage people to come back for their follow-up consultations, because there's so much more to do than just the pelvic floor exercises, such as lifestyle factors and things like bladder retraining. So bladder retraining is when we teach people how to calm down their bladder and get back control. So it's for people who are really struggling with urgency, so that sudden intense need to go to the toilet, they've sort of got to drop everything and run, or frequency where they're going to the toilet quite often. And we teach you how to calm the bladder down and get back control so that you can walk calmly to the toilet and not be worried all the time about where the nearest toilet is. I actually think this is quite important, because there's a lot of people that give up their social outings, or it affects their career or their family life because they are needing to go to the toilet all the time. The other sorts of things that are separate to pelvic floor exercises that you might learn during pelvic floor physiotherapy are things like how to empty your bladder all the way. So some people have trouble emptying, or they feel like it hasn't emptied all the way, so I can help you with that, and also teach you about healthy bladder and healthy bowel habits.
Thank you so much for your time today, Karen. You're such an asset here at Physio for You. We love having you here.
It's my pleasure. I love working at Physio for You, Wollongara.